Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call, and today I talk with Gigi Granval about a new report confirming the origin of SARS-CoV-2 as a spillover event from a seafood market in Wuhan. We talk about why it took so long to pinpoint the emergence, what we now know about where the virus came from, and why it's important for preventing future pandemics. Let's listen. Gigi Granval, thank you so much for joining us again on Public Health on Call. Today, we are going to talk about a recent report that confirmed that a seafood wholesale market in Wuhan was the early epicenter of the COVID-19 pandemic. So let's start off with, first of all, why was the origin of SARS-CoV-2 in question in the first place?
Yeah, so there's been a lot of evidence up to this point that the market was the epicenter of SARS-CoV-2, but this recent couple of papers that were published in Science magazine really are the death knell for any alternative theories. And the reason why people thought that it wasn't the animal market in Wuhan was because they're right next door, in that same city, is a laboratory that studies the Virology Institute, where scientists were studying coronaviruses. So people thought, well, maybe it came from a lab. But the evidence definitely shows that the market was the culprit, just like in SARS in 2003, where it was the live animal market that led to the emergence of SARS, and which was a smaller pandemic, but nonetheless very concerning.
So what exactly do we know now about this animal market, and how do we know it?
Yeah, so there were some indications before, because a lot of the early cases, 3/4 of the early cases, had some association with the market, and none had an association with the laboratory. And even though they're both in Wuhan, they are actually in different parts of the city, separated by a river. So it was easy to separate those out. There were also other indicators that there were two lineages, so two separate variants of SARS-CoV-2 that were circulating in the early days of the pandemic, and one of those became the pandemic, but the other one died out. But that would mean that there would have to be two introductions from a laboratory versus an outbreak that's going on among the animals and then spilling over multiple times to people. But these scientists, they looked for two things. They did a geospatial analysis, so really tracking those cases that we know about and pinpointing exactly where in Wuhan these cases were associated with. And they were even more tied to the market than previous indicators had suggested. And they also looked at those two strains and looked for lineages to see how they evolved, and also tying it to an animal spillover. But they got down to the exact stall of where one of the positive environmental samples had come from. And there had been a picture taken just a couple of months prior where a raccoon dog had been sitting in said stall. And raccoon dogs are one of the prime suspects for where the virus came from.
And when you say raccoon dog, because the coronavirus originated in bats, so the raccoon dog could have been that intermediary animal?
Correct. Yes. We think that it's a bat virus that spilled over into an animal population. This is a very permissive virus, or what they call a generalist virus. So it's able to infect lots of different animals, but raccoon dogs are one of the animals that it's known to infect. and they look like, we don't have them here in the U.S. They look exactly like what they sound like. They look like raccoon dogs.
And they're used for meat in
Meat
China?
and fur, yeah. I mean, you're not supposed to, a lot of the animals that were held at the market and being sold were not supposed to be sold in the market. But there have been reports since the pandemic, pictures taken right before where clearly illegal animals were being sold. They were in poor condition. They were stuffed together in cages, that were right next to each other. Really not a good situation for limiting disease transmission. And raccoon dogs are super cute animals, but like these are not. And all of the animals that were pictured were really just not in good health and really not being taken care of as maybe one would expect for an illegal trade.
I want to come back to talking more about the wildlife trade and the safety of these markets. But first, I want to ask, so the researchers pinpointed this back to, I think, December of 2019. So we're looking at a little more than 2.5 years later now that they're finally coming out with this confirmation. So what's been happening in the interim?
Yeah, there's been a lot of back and forth, a lot of propaganda, a lot of finger pointing, and nobody comes off looking all that great, except, of course, I'll plug for the scientists looking good for figuring this all out. But yes, the U.S. From early days accused China of this being a deliberate attack. There were lots of China in turn accused the U.S. of having the virus coming from an army lab in Frederick, and so there were lots of baseless accusations flying around, and the well was definitely poisoned with lots of language. If you recall, some of the things that the former president said that were racist and inflammatory and definitely not conducive to actually getting to the bottom of where the virus came from. There was a WHO investigation, and it was a fact-finding mission. A bunch of experts from all over the world did research. They went to China. They looked at the data, the early clinical data. They were not shown everything that they could have been shown, but the team produced a 150-page report, which I know that many of the people who didn't like the report didn't even bother to read, but they did produce a lot of information, and they said that it was unlikely to be an accident. They did not. China really was adhering to this theory that the virus didn't even come from China, that it came from a frozen food. Yes, it came from a frozen food importation from some other country. And by frozen food, I don't mean like Stouffer's. I mean like a whole animal carcass frozen and imported from another country, and that the virus may have stemmed from that. So there's just a lot of counter narratives, misinformation, disinformation, all thrown at the question of where this virus came from.
Why is it so important to pinpoint this emergence point, or this? Would you call this a spillover event?
Yes, I'd call it a spillover event. It's really important to figure out why things happen so that you can prevent them from happening. and so that's certainly the case here. There are a lot of uncertainties in any investigation like this. I mean, a lot of people get sick with all kinds of things all the time, and you don't think to record it in meticulous detail, not knowing whether or not it's going to be important, because almost all the time it's not. So the origins of many infectious diseases are a little bit fuzzy. That's the case with Ebola, with the first cases of monkeypox. I mean, so there's a lot of uncertainty from which these diseases come from. But for a pandemic of this scale, it's important because we don't want to leave the same conditions open for it to happen again.
And I do want to get to that point again with the markets themselves. But first, let me ask about what have we learned from the larger context in terms of surveillance and virology for this particular pandemic that we can maybe apply to future events?
Yeah, we've learned a lot here. I mean, I think we have a bit of a mismatch in our capabilities and our expectations. We have the potential to trace really one virus being transferred from one person to another. You can, there is no sample that we can't analyze, but what you can do is go back in time and find those samples that no longer exist. And so we have this expectation that we can analyze everything to the ninth decimal point, but in a lot of cases, you just can't look at what you didn't bother to collect. The other thing that really is important is we look where the light is, and we can see only what we know. And there's a lot in the natural world that we don't know. And I think people need to remember that, there's a lot of viruses that are being passed now between bats and animals that we are not looking at. We don't know what is brewing in that sea of genomic information, and so we may think that we have a good handle on coronaviruses or flu viruses, but there is a limit to how much we have been collecting, and so there's a lot out there for people to discover.
And so it seems like these, as they're called, wet markets are sort of the perfect confluence of all of these factors. You've got wild animals, you've got humans. They're both in very close quarters. Tell us more about, can these live markets be made safer? What's the, impact of, some people have asked to close them. So where are we with that?
Yeah, so I mean, there's guidance for how you can have a live animal market and have good biosecurity. Biosecurity in that context is really just keeping animals separate from each other. The WHO, FAO, actually they've renamed, but international organizations that are concerned with animal and food health, they have guidance for how where you want to basically butcher animals in a different place than where you're feeding them and where they're defecating. This may seem obvious, but there are rules for how you do this. What you don't have by closing them is you don't have a way to have an off switch on people's drive to have these animals. There's a lot of demand out there for all kinds of animals that people get at markets, and you can't just turn that off. I mean, that sort of change takes a lot of effort, and there's a lot of money involved in stacked up against you to make these changes. It's hard to get estimates for illegal markets, but people have estimated that the illegal wildlife market in China alone ranges somewhere between $18 and $75 billion per year. And those are big error bars, but I mean, it shows you that's bigger than the US beef industry. These are huge numbers and a lot of demand, a lot of money. And on the other side, you have you want to ask a public health official to turn that off. So there's a lot of work that needs to be done to, reduce demand, but also make the live market safer and to have them be more regulated. So just passing a law is not going to turn any of that off.
What is the next step for research here? Do we close the book on this origin story and just say, okay, this is how COVID started, and now we move on with our lives? Is there more implication here from this finding? What do we do with this?
There's a lot that needs research in the face of SARS-CoV-2. We have had a plethora of research and effort go into this virus over the last couple of years, of course, but there's a lot that we don't understand about coronaviruses. There's a lot we don't understand about bats. I think it's shocking how little we actually understand about this creature that has been really, the source for a lot of our emerging infectious diseases, not to mention like Hanta, Ebola, Nipah. I mean, this is actually, can I stop?
Yeah.
Okay, because I think Hanta is Hanta. I think Hanta might be mice.
Hanta's mice.
Yeah.
Okay. So we'll take that part out. That's okay.
What was your question?
Where do we go from here?
Research?
Yeah, research.
So there's a ton of research that needs to be done, not just on coronaviruses, but all the steps involved here. We really have a lack of understanding about the animal vectors that have given us SARS-CoV-2, especially bats. Like, we don't have the tools, the research tools that are needed. There are not enough cell lines. There are not enough universities that have bats that they're studying their behavior. Why are they able to carry diseases and not get them themselves? There's just a lot that we don't know about bats. Considering that we've gotten a lot of emerging infectious diseases through that pathway. There's a lot that we need to understand also about not only live animal markets, but how we are encroaching on bats' territory and what that will mean for other infectious diseases. This virus came via commercial sale of animals, but humans are developing land that used to belong to bats, or are getting very close to bat territories, putting us into contact with more potential spillover events. So there's a lot that needs to be studied, and there are not that many people who do it. A lot of the focus in the early origin story has been to demonize a lot of the scientists who do this work, who actually study the transmission of novel diseases into populations, and in particular, one group called the EcoHealth Alliance. But the fact to me that you can name a lot of these researchers in this field it says it's a small field. Try and do that with HIV. Try and do that with any particular oncology specialty. You couldn't do it, but this is an area that has immense consequence for the whole world, and yet there are not that many people studying it.
So this conclusive report about the origin is opening the door to where we need to shine the light.
Exactly. I hope that people will set aside, even if they really were attached to the theory that the virus came from a laboratory, that they look at this evidence and that it will be a step to trying to work on next steps with China. And China is not the only country in the world that has live animal markets and this potential for spillover. So there's a lot of work that should be done here in the US as well as around the world to make sure that we reduce the chances of this happening. But right now, we're not doing nearly enough. We're barely doing anything.
And we will check back in with you periodically to see how that is going. Gigi Granvall, thank you so much for joining us.
Thank you so much for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.